The field of obstetrics and gynecology has historically exploited and oppressed enslaved Black people and pathologized race through unscientific and harmful claims of racial differences. The false claim of racial differences in pelvic measurements remains an unfounded reason why vaginal births are not successful. The legacy of this harm is entrenched in the VBAC risk calculator's use of race. The use of the Black race and Hispanic ethnicity as correction factors for the VBAC calculator has shown that Black and Latina patients have 50% lesser odds of a successful VBAC, contributing to Cesarean overuse. There were also findings of omitted social determinants of health and repeated racial discrimination, leading to unnecessary Cesarean births. This is a reflection of the racial health inequities in maternal health, the impact of institutional racism, and the limitations of birth equity in Black and Latino women and birthing people.
For Black women and birthing people seeking care through the U.S. healthcare system, inequities faced during pregnancy and childbirth can be traumatic and oppressive and disempowering towards their birthing experience. In the United States, Black women and birthing people are 3 to 4 times more likely to die from pregnancy-associated causes than white women. In New York City, the rate is 4 times more likely than white women. Nationally, Black women and birthing people continue to have the highest cesarean birth rate at 36.8%, followed by Latina women and birthing people at 31.7%. Higher cesarean delivery rates are contributing factors that worsen the Black maternal and morbidity crisis. While a cesarean birth can be a life-saving procedure for mom and baby, exposing birthing people to a surgical birth increases the risk of complications like hemorrhaging, infection, and poor placental implantation in future births, which can lead to hysterectomy, extended recovery, and in the worst case, death.
The misuse of race in the VBAC calculator is an example of the incorrect historical legacy of race as a biological construct. Race essentialism is the false belief that race is a fixed and unchanging biological property and should be used as a determinant for the clinical care decisions. Race essentialism, or race as a biology, feeds into the historical, structural, and medically racist systems that create racial inequities and continues to harm Black people and people of color.
Understanding that racism is a system that unfairly advantages some populations while unfairly disadvantaging other populations based upon skin color highlights the need for equitable and actionable steps that consider best practices for the use of race to eliminate inequities throughout clinical decision-makings, policies, recommendations, and guidelines. Labor after cesarean, vaginal birth after cesarean choices should be patient-centered, be a product of shared decision-making, prioritize personal preferences while balancing risk and safety for effective provider counseling. A VBAC calculator that removes race as a risk factor is a step towards promoting anti-racist practices and reverses the policies and actions of individuals that have disadvantaged Black and communities of color and upheld systemic racism. Race consciousness aims to remediate the power dynamics between providers and patients and empower equitable labor after cesarean and VBAC counseling.